Yes, paracetamol is the most unscientific and dangerous drug for fever. Anyone can create a fever within hours using antipyretic objects. Introduction. Any substance that is cooling or reducing temperature, that means antipyretic, is a fever stimulant because it increases inflammation and reduces blood flow. Antipyretic are the only substances.
Excuse me, doctor.
Sorry?
Can you speak a bit loud?
Sorry?
Can you speak a bit loud?
Okay.
Okay.
Any substance that is cooling or reducing temperature, that means antipyretic, is a fever stimulant because it increases inflammation and reduces blood flow. Antipyretics are the only substances needed to induce fever and hypothermia in any organism. Paracetamol is an antipyretic substance. Anyone can create a fever within hours using antipyretic objects. It's audible? Can you hear me?
Yes, you're audible, doctor.
That's okay. Paracetamol cures fever and causes fear. Ignorance of the subject is the root cause. The medical book states that paracetamol may cause fever, neutropenia, thrombocytopenia, nephropathy, and skin reactions. This is not a side effect of paracetamol, but its proper function. If it is said that the modern medicine, if it is said that the medicine used to reduce the temperature of the fever itself causes the fever, the scientific and authenticity of that medicine are being questioned here. There is no science or technology like this anywhere in the world. Today, hypothermia is called fever. As we are aware today, hypothermia and fever are divided into three categories based on the severity of the temperature. First one is mild or low grade hypothermia. This is temperature in between 100 to 102 Fahrenheit. The same temperature is used to determine mild or low grade fever. Next one is moderate grade hypothermia. It's a temperature in between 102 to 104 Fahrenheit. The same temperature is used to determine moderate grade fever. High grade hypothermia, it is greater than 106. The same temperature is used to determine hyperpyresia. Hyperthermia cannot be created by fever causing agents. Fever cannot be created by hyperthermic agents. The source of fever and the source of hyperthermia are not the same. Fever does not occur from a source of hyperthermia. Hyperthermia does not arise from a source of fever. Lowering the temperature will not cure the fever. A decrease in temperature is not enough to reduce the fever. All substances and their functions which only increase and decrease during fever must return to the state they were in when there was no fever. Pyrogens which raise the temperature during fever are not the only immune system created. Therefore, if prostaglandin E2 is reduced with paracetamol and the temperature is reduced, the fever will never go away because all the substances produced only during fever and their functions will not return to their old form. Most people mistake fever as high temperature and think it is dangerous and take paracetamol to reduce temperature as fever is determined by checking temperature. A high temperature is not a fever but hypothermia, which is the opposite of fever. Hypothermia has none of the features of fever. Fever and hypothermia are mutually exclusive. Hot objects of the same temperature as fever or heat producing substances cannot cause fever in any living being. Any substance that is hot or heat increasing That means pyretic are the only substances need to cure fever in any organism. In hyperthermia, the temperature does not come from the same source as in fever. So there is no similarity between what happens when there is fever and hypothermia, and they are contradictory. The only cause of fever is inflammation, but the only cause of hyperthermia is high heat. Antipyretic fever treatment never reduces inflammation but increases it. Feverish temperature works against lack of blood flow and increased blood flow. Since inflammation is the only cause of fever, symptoms, signs, signals, and actions are shown when inflammation occurs. That is why the body hates cold and likes heat during fever. The body's lack of heat energy prompts the immune system to produce warm substances such as prostaglandin 2, construct blood vessels under the skin to conserve and prevent loss of body heat, reduce the fire rate of warm sensitive neurons that sense heat, and increase the fire rate of cold C neurons that sense cold. Similarly, in hyperthermia caused by extreme heat, symptoms, signs, signals, and actions of overheating are shown. This is why the body hates heat and loves cold when hypothermia occurs. The essence of today's fever treatment is fever can be cured by using fever-creating substance. Here, we consider the basic contrast between the basic action of fever and the basic action of paracetamol. Paracetamol is given to reduce prostaglandin 2, which increases temperature. Prostaglandin 2 is not a fever-causing substance. It has hyperthermic, vasodilatory, and anti-inflammatory properties. Hyperthermic substances never cause fever. They cause hyperthermia, the opposite of fever. The heat of fever and prostaglandin 2 are the most abundant substance in the body during fever. It is more abundant after the inflammation in the body. They are not abundant before the inflammation. Prostaglandin is found in the body during fever, similar to the airbag used to protect passengers in a car accident. Any substance that is hot or heat increasing, that means pyretic, is a fever reducer because it reduces inflammation and increases blood flow. Endothelial cells produce prostaglandin 2, which is an important part of immune system. The endothelial cells are the main regulator of vascular homeostasis. Paracetamol, which reduces prostaglandin 2, is given for fever, mistaking this as the cause of the fever. Paracetamol destroys prostaglandin 2 without being recognized by the immune system to increase blood flow and reduce inflammation. Fever does not go away if heat-producing substances are removed from the body. Fever can only be relieved by avoiding substances that reduce heat in the body. Paracetamol is given to the patient to eliminate the prostaglandin 2 found in fever, just as those who do not know the purpose of an airbag in a car accident disable it, thinking that someone will die in a serious accident because of the airbag. As a result, the body cells blood flow decreases and the patient dies. Paracetamol works in favor of inflammation, which is the underlying cause of fever. Paracetamol also destroys prostaglandin 2, a heat-sensitive pyrogen produced by endothelial cells to reduce inflammation and increase blood flow. Paracetamol does not reduce the underlying cause or symptom of fever, disease, or cause of disease, but increases it. Antipyretic therapy is a necessary and appropriate treatment for hyperthermia and not for fever. Paracetamol does not reduce fever, the cause of fever, morbidity, or mortality, all of which are increased by paracetamol. Paracetamol destroys all the protective substances our immune system makes when we get sick. It decreases prostaglandin 2, glutathione, interferon, platelets, WBC, etc. Even for disease that would have cured themselves due to the action of our immune system, using paracetamol can cause inflammation, reduce blood flow, and death. A claim to cure fever by using fever-creating substance is not called a treatment, it is a murderous attempt. Paracetamol is the most dangerous medicine for fever for those who have proper knowledge about fever and the action of paracetamol. Without knowing this, paracetamol is a fever reducer for those who firmly believe that a fever occurs when the body temperature rises above 38 degrees Celsius and the fever disappears when temperature drops. Medical books say that antibiotics cause prolonged infection which increase death. This is not a side effect of antibiotics, but its proper function. Depletion of prostaglandin 2 and glutathione, which reduce inflammation, can also increase inflammation. No such a treatment or science was found even in the Stone Age. Paracetamol is prescribed for many painful symptoms and ailments. Many ailments like back pain, neck pain, and joint pain are caused by inflammation. Prostaglandin given to relieve pain re-inflames the inflammation. Reducing heat-producing prostaglandin 2 will never reduce inflammation but increases it. Most of the people who took paracetamol reported that their fever went away when they took paracetamol. Is this correct? That is another question. The question is whether these people to know what a fever is, to know if this experience is true. All those who share this experience are those who did not know what is the correct definition of fever and a mistake it for fever when the temperature rises above 38 degrees and felt that the fever went away when this temperature decreased. The only way to change their misconceptions is to understand what the correct fever definition and testing are and what happens when you only have a fever. The reality of paracetamol experience can be realized if one also recognizes the fact that anyone can get a fever with antibiotics alone, and that fever is defined, tested, and treated as hyperthermia at a temperature greater than 38 degrees Celsius that has no resemblance to fever. Conclusion. From the above evidence, paracetamol is the most unscientific and dangerous drug for fever. Anyone can get a fever within hours with antibiotics. Antibiotic treatment for fever is wrong, and paracetamol will not help cure fever. Fever is caused by destroying the immune system in any way. Fever heat to increase blood flow, and fever needs pyretic treatment. No other illness or symptom is more unscientific than justifying the administration of paracetamol for fever. No disease requires paracetamol to reduce temperature. Paracetamol is also not effective in hyperthermia where it is necessary to reduce the temperature. So giving paracetamol for fever should be banned as soon as possible. There is no other disease or symptom that is more unscientific than the assessment of fever. The same is true of paracetamol as it is of fever. There is not even 1% evidence that paracetamol helps the immune system in any way. At the same time, there is 100% evidence that it destroys the immune system. Taking paracetamol for fever is suicidal. Reference. Thank you hearing me patiently so far. If you have any questions, you can contact my WhatsApp number or my personal email ID.